Renal failure, also known as kidney failure, is a condition where the kidneys lose their ability to filter waste and fluid from the blood. There are two types of renal failure: acute and chronic. Acute renal failure occurs suddenly and is often reversible with treatment. Chronic renal failure develops gradually over time and is usually irreversible. Both types of renal failure can cause serious complications and require medical attention. The symptoms of renal failure depend on the severity and cause of the condition. Some common symptoms include nausea, vomiting, loss of appetite, fatigue and weakness, changes in urine output, swelling of the feet and ankles, high blood pressure, chest pain or shortness of breath, confusion or mental changes, muscle cramps or twitching, itching or dry skin. Some people with renal failure may not have any symptoms until the condition is advanced. Therefore, it is important to have regular blood and urine tests to check your kidney function and diseases such as diabetes, high blood pressure, or a family history of kidney problems. Having a history of Alzheimer's disease may not directly affect your risk of developing renal failure, but it may make it harder to recognize and manage the symptoms. Alzheimer's disease is a progressive brain disorder that causes memory loss, cognitive impairment, and behavioral changes. People with Alzheimer's disease may not be able to communicate their symptoms, follow their treatment plan, or take care of their personal hygiene. They may also have other medical conditions that can worsen renal failure, such as infections, dehydration, or medication side effects. If you or someone you know has renal failure and Alzheimer's disease, you should seek medical help as soon as possible. You may need dialysis or a kidney transplant to treat your renal failure, depending on the cause and stage of the condition. You may also need medication, lifestyle changes, and supportive care to manage your Alzheimer's disease and improve your quality of life. Kidney failure is a serious condition that occurs when the kidneys are unable to filter the blood and remove waste and excess fluid from the body. There are different treatment options for kidney failure, depending on the cause, severity, and symptoms of the condition. Some of the common treatment options are hemodialysis. This is a procedure that uses a machine to move your blood through a filter outside your body, removing waste and excess fluid. You may need to have hemodialysis several times a week at a dialysis center or at home. Peritoneal dialysis. This is a procedure that uses the lining of your belly to filter your blood inside your body, removing waste and excess fluid. You can do peritoneal dialysis at home, at work, or while traveling. Kidney transplant. This is a surgery that places a healthy kidney from a donor into your body to replace your damaged kidneys. A kidney transplant can come from a person who has just died or from a living person, such as a family member or friend. Conservative management. This is an option that offers care without replacing the work of the kidneys. It involves managing the symptoms of kidney failure with medications, diet, and lifestyle changes. It also includes planning for end-of-life care. The best treatment option for you depends on your personal preferences, medical condition, and availability of resources. You should talk to your healthcare provider about the benefits and risks of each option and make an informed decision that suits your needs. Kidney stones are hard deposits of minerals and salts that form inside the kidneys and can cause pain, infection, and other complications. The symptoms and treatment of kidney stones depend on the size, type, and location of the stones. Some common symptoms of kidney stones are severe, sharp pain in the side and back, below the ribs. Pain that radiates to the lower abdomen and groin. Pain or burning sensation while urinating. Pink, red or brown urine. Cloudy or foul-smelling urine. A persistent need to urinate, urinating more often than usual or urinating in small amount. Some common treatments for kidney stones are drinking water. Drinking as much as 2 to 3 quarts, 1.8 to 3.6 liters, a day will keep the urine dilute and may prevent stones from forming or help pass small stones. Pain relievers. Taking pain relievers such as ibuprofen or naproxen sodium may help ease the discomfort of passing a small stone. Medical therapy. Taking medications such as alpha blockers may help relax the muscles in the ureter and facilitate the passage of kidney stones. Shockwave lithotripsy. This procedure uses sound waves to break up large stones into smaller pieces that can be passed in the urine. Ureteroscopy. This procedure involves inserting a thin tube with a camera and a tool into the ureter to remove or break up stones that are stuck there. Percutaneous nephrolithotomy or nephrolithotripsy. These procedures involve making a small incision in the back and inserting a tube into the kidney to remove or break up large or complex stones. The type of treatment depends on several factors, such as the size, shape, composition, and location of the stone, as well as the patient's medical history, symptoms, and preferences. The doctor will recommend the best option for each case.